Namaste Nilachal, we can begin.
Namaste everyone. Welcome to this webinar on women's health and on the platform of Gitananda Integrative Therapies Academy. And you will be going to know more about that at the end. And there is a surprise for you. But today with women's health, let us start with the invocation. When we have this wonderful webinar to get started, let us smoke the Gayatri mantras. Gayatri mantras, as we all know, the Gaya is the Pran and Tra is the Tran. Who protects our Pran is the Gayatri. So let us start with the invocation of Ganesh Gayatri. Om Tad Ganeshaya Vidmahe Vakratundaya Dhimahi Tanno Dante Prachodayate Om Om Katyayanaya Vidmahe Kanyakumari Dhimahi Tanno Durga Prachodayate Om Om Varalakshmi cha Vidmahe Vishnu Patni cha Dhimahi Tanno Lakshmi Prachodayate Om Om Veena-ganaya Vidmahe Vrincha Patni cha Dhimahi Tannaha Saraswati Prachodayate Om Om Tat Paramparayaya Vidmahe Jnana-lingeshwaraya Dhimahi Tanno Guruhu Prachodayate Om Om Yogamarshi Dr. Swami Gitananda Giri Guru Maharaj ki Jai. Om Pudvai Kalma Mani Pudvai Shakti Yogacharya Amma ji Meenakshi Devi Bhavanani Guru Mata ki Jai. Om Shri Guru Bhyo Namaha Hari Om. So again, I welcome you all on this wonderful occasion of Makar Sankranti Pongal. And what auspicious day can it be other than this Pongal, when we're starting something new, and the harvest festival that is being celebrated all over the country with different names. Pongal here, Makar Sankranti in the north, Tusu in some parts of the other the country. And first of all, thank you for taking time for joining with us, and your presence really means a lot. And I just wanted to start with a very important aspect that why we have this session, and just to go back into that one small philosophy that I want to point here is life is not about taking. And before this session, we had a very good yantra session, and there also we understand like life is about giving. It is all about giving. And when we begin to take, there are a lot of expectations to demand, to accumulate, and that is where the imbalance and disturbance begins. And in Indian culture, if we go back in like who we worship in different aspects, so when we talk about teachers, in our tradition, teacher is worshipped, and teacher gives education. A guru gives more, even more, without keeping count. And we have the mantra Sahana Bhavatu, Sahana Bhunaktu, Sahaviryam Karvavahe, Tejasvinavaditamastu Mavidvishavahe. So the teacher and the student grow together. So that is only by giving only. And when we see the principle clearly in other roles and responsibility, so there is a when a father truly becomes a father, he gives often silently. His comforts become secondary. The family becomes the topmost priority. And before this session, like how Balaji sir was managing and testing and all things. So this comes there. So there's a responsibility where the family comes first. Men too faces challenges, obviously, real and complexes, but that conversation is for some other day. Today, when we observe women across cultures, countries, and colors, we see something extraordinary. And an energy that gives, nurtures, sustains, and holds, often without recognition, often without pause. So we all have experienced that, and that is why the conversation around women's health are not optional, they are essential. So that is very much important where we worship Acharya Devo Bhava, Pitru Deva Bhava, and there is on the top is the Matru Deva Bhava. So women's health is of topmost priority, and this session is not about overwhelming anyone with the information, and is about understanding women's health through medicine, through the life philosophy, the actual aspect, lived experiences, and holistic awareness all together. So, just giving a basic and a disclaimer with all those, just to have be with us till the last of this session because you are going to gain something interesting at the end as well. And till the end, requesting all to just to keep the microphone off and all those things that you already know. And we will begin with the opening reflections. The whole session is divided into a few parts with the medical perspectives with our eminent speakers who have joined here, followed by an open panel discussion and conclude with audience interaction, the question and answer. So there's a good news. So all say at the end. So stay tuned. And to begin with, I would like to invite Shakti Ma at this point, Yogacharya Devasena ma'am, for the opening address. And just to let you know, we all know her. Just to give a brief intro about her, Yogacharya Devasena Bhavanani ji is a senior yoga teacher, Bharatanatyam dancer, and Carnatic vocalist with over 35 years of experience at ICUIR and Yoganjali Natyalayam. And she is renowned for integrating yoga,
Yes,
classic,
yes.
classical dance, and devotional music, inspiring audience worldwide. So, without taking much time, I would like to invite Devsana ma'am for the opening address.
Namaste. Namaste, everyone. Happy to see you all. Happy Pongal. Belated Happy New Year. Very happy to be with all of you. Yes. Taking Gita starting. It's very happy news in the Happy New Year. Again, in that we say in proverb, in the Tamil proverb, "Thai Pirandal, Vai Pirakum." When the Thai month starts, there's a way also will along with that Thai month. So, like that, it's a nice sign and good day, very auspicious day to start Gita. And again, our Chairman Sir Guru, Ananda Balayogi Bhavanani's guidance, our Nilachal Bhaiya taking forward. I was very happy to know that. And yes, today's talk about the women's health. Yes, women's health. Yes, there is a lot of plus point and the negative points, and there's a lot to talk about women's health. Means just generally, women are. I mean, it's not a to extent, but the women mostly take care of the responsibility most of the time. We see in the families, as we say, like Dr. Balaji's family, with the family, he also taking other things. Means, yes, Shamili also there with the family. Of course, Shamili will make, I mean, preference first in the family. So, like that, in the every family, like the women will have the, I mean, more duties, more, I mean, responsibilities and taking care of everything. It's not that just they're not doing, they're also doing equally one way. But at the same time, like she need to really act like, I mean, like in the drama, we do all the characters, like they will be dancing and again in the in between, she need to go like a swan. Again, she has to just dance onto the swan. So just like that, the woman has to really change to the character to character in every day. Quite a few characters she has to fulfill the dharma of, I mean, the mother, wife, sister, whatever. all the, on top of the friends, everything, for everyone, for everybody. So in even every time or almost all the time. So they have a lot of thing to, to juggle here and there. At the same time, they also, most of the time they are managing. And as we say, even the Shaktis we have, we say like our Ammaji, Adi Shakti, so she can just do from the sitting place. She can do like our Rishis, Munis, from the wherever they are sitting with their tapas. The energy, they can just go through, travel everywhere. So like that, our Ammaji from sitting place, she can just do everything. So I am just, I was wondering actually how she managed everything. So like that, from the place like Adi Shakti, even we have like, we say Durga Lakshmi Saraswati. So, the Kriya Shakti, Jnana Shakti, Icha Shakti. And but of course, yeah, lady, even one lady, even in the family, she need to fulfill all the Shaktis, all the things, actions or whatever has to go through for every day, every momentum, even every minute, every second, every kshana, even actually. So in that, when we see, yes, they are, they are more, but they need to be very energetic. And most of the time we say they are not really taking care of themselves. Of course, we have our professional doctors going to give the talk about the women's. Most of the time, they don't really take care of, and some of them maybe, I'm not telling fully, but at the same time, when we see, yes, they need more care and they need to think about themselves also. As we have, we think in yoga also, we have our Swadharma, but at the same time, most of the time, we just think about the mothers, always think about the whole family for each and every person, but they won't think about themselves most of the time. So that's what happening. And so, yes, they need to take care of themselves also. Yes, sometimes, most of the time, it's not possible. They need to find. So at least by going to the classes, yes, they can relax. They can take care of themselves. I see with our housewives, they also performed in our dance drama. So nice to see them, how energetic, how positive they are, and very happy to see them whenever I was with them. So it was very happy to see all the Shaktis there, Yognath Shaktis. So we honored them also, like Yognath Shaktis, I think in the 25th year of Yoga Natal Annual Day. So like that, when they come into the yoga class, I really enjoy with them. So similarly, for me also, when I'm going to the classes, yes, I enjoy. And of course, whenever I go to the, pujas, the homas, attending, I'll be really getting the energy, because I remember very well when I'm going to the classes, sometimes I'll be very tired. Like that I will be going, but after that, going to the temple, I just have the energy to go on for the whole evening. The yoga class, dance class, in between. If the music teacher absent, then attending taking care of the music class also. Just like that, yes, we can go on and on, because most of our programs like that, we got used, whatever the puja or the programs, all very long. And so we got used. So still with that Amaji, Swamiji's, the like a regularity, repetition, rhythm, as Amaji always says. So we got used like that. But how even with me, sometimes I feel, yes, I want to sleep like that. But how many maybe not really taking care of them, and they don't really relax in Nishbanda or even Shavasana at least 10 minutes. So how most of the time, most of them managing is question mark. So yes, we have the speakers coming up, so they can give, because they see a lot of patients coming to them, and so they have the practical issues also, how they are managing, how much they are feeling, and yes. So the only thing, like the as we go, like with the culture, I feel more satisfaction, happy, like today Pongal, yes, but because of the Pongal, like because of the Margari month, as Lord Krishna says in the Bhagavad Gita, I am the Margaseshanam. So like that, I'm the month of Margari. So like that, in the Margari month, yes, I do feel like, okay, chanting whenever I get up, like sometime like 4:30 or 5, whenever I get up, at least chant something in that time. So like that is give the auspicious time, the morning time. So it's give the energy when you are chanting and yes, in the early morning especially. So like that, I do feel like the energy when we are going to the puja or doing the cultural thing like getting up early morning for the pongal columns to do. So automatically you are not really feeling still sleepy or tired. No, never. Even though paining, maybe later sometime, but still you are going with the energy and wants to make the columns and celebrate the pongal. Yes, that's give really when we are, I mean, following our culture and doing the necessary thing as Dr. says. Yes, whoever, I mean, whoever wants to do, I mean, whatever they have to do, if they are doing their things, they'll be happy. Yes, as Swamiji says, yes, if you are the student, do your student's duty. If you are the family grahastha, then take care of the family. So everything, yes, as Swamiji says, yes, as he says. So be happy, then, I mean, it's a birthright. So as he said, yes, doing the happy things makes happy. Yes, as I feel, yes, the classes teaching or going to the puja or like participating in the, I mean, the ceremonies, doing the ceremonies, that gives really the positive energy. And to go through the energy also we get, as we say, Om Shakti, Durga Lakshmi Saraswati. So Icha Shakti, Kriya Shakti, Jnana Shakti. So with that, those energies like that with us also, with our all our activities also helps with that when we are following our culture. Yes, it's really helping. So yes, we'll see whatever coming up.
Yes, ma'am.
Our
Thank you so
speaker.
much.
Thank you.
And thank you so much. And that's why there is there is a filmy dialogue and all, like there is a common man, but there is no common women. So all women are special. So thank you for giving that insight and thank you so much. And now I'd like to invite our dear Dr. Ananda sir, Puducherry Yogacharya Dr. Ananda Balayogi Bhavanani ji, uh, to give his blessings on this first ever webinar of GITA. And to talk about him and his qualification is just we can't cover in this whole session also. And today I got a chance to glimpse like his biodata and all. It was huge. So I just can say in a few words that when I was studying in my masters and when we were looking for some research papers and all, so we were always looking up to a name that was like Dr. Ananda Balayogi Bhavanani, and he was like, if you relate in that way, the Rajnikant here, how he's being worshipped. So he is like that at that time for all of us. So I would like to invite Dr. Ananda sir. So we look forward to your blessings. Over to you.
Thank you, Nilachal. You got me chuckling with that Rajini comment. So thank you for that. First of all, a very happy Pongal in this part of the world. Different parts of India have different festivals to do with the harvest, especially at this time. And wishing everyone a very magnificent and spectacular New Year. Gita, as the name comes together, reminds us of the importance of integration. So here, the Gitananda Integrative Therapies Academy is bringing together different forms of therapeutic aspects of healing system, both traditional and modern, for the welfare of humanity. And yesterday we had the launch at our headquarters next to the Yoganjali Natyalayam, and this headquarters is on the first cross. Yoganjali is second cross, and it is at Ananda Bhavan. And don't confuse with other popular places where you get to eat. Here you will get nourishment for your soul, for your Atma. We'll also in the future have some other things. And Ananda Bhavan. Remember, it's Ananda, not Anand, and it's a Bhavan, not Bhavan. Okay? So we'll have the Gita functioning from there. We'll have Sannidhi Yoga functioning from there, and also Divyananda Creations. And we hope to have a lot of activities beginning at this auspicious time. And I was telling them in the yantra that even without knowing it, it was a very auspicious day personally for me yesterday, a 3x1 day, where there's a beginning of a lot of creativity manifesting. I'm very happy that my dear Nilachal, who is spearheading this into the future, along with the support of the whole GITA team, decided that today, on the auspicious first day of Thai, which is for us auspicious time in Tamil culture, that planned to have this webinar that focuses on women's health with two dynamic Shaktis, our dear Dr. Shamili and Dr. Lothikha. And Lothikha has been our daughter for many, many years, and Shamili's also became part of the family, came in as a daughter-in-law, but is our daughter also. And both of them very amazing young women who are serving humanity through their health care, through the actual care that is manifesting for health. And I think this is a beautiful topic, as Devasena pointed out, that the women are the foundation of all families. And in India, we have again and again seen that if the woman of the family is healthy, the family is healthy. If the woman of the family is happy, the family is happy. And of course, to add to it, if the woman of the family is wise, the family will be guided through that wisdom. However, though we say this, often we find that the women are neglected and the health care needs of the women are not given the priority they deserve. Women are taught as young girls here in this culture to take care of others, to serve others, and forget that the Swadharma, as given to us by Lord Krishna in the Bhagavad Gita, is take care of yourself so that you can take care of others. Swadharma is paramount. And this is why when we talk about managing healthcare needs of the women, it is important that we let them understand they are not being selfish, but they are being selfful. Recently, my dear Anandi and I were having a conversation on this as part of our Sannidhi work, and we realized that often when you take care of yourself, people think you are being selfish. But actually, when you take care of yourself, you are being self-full. Like we say, mindful, heartful. We have to be self-full by focusing on that self. That is our Swadharma. And when we focus on the self, it is a salutogenic focus that empowers the individual to be in a better state of health, physical, mental, social, emotional, even financial, that can then support those who depend on her as the fulcrum of the wheel. Hence, I hope that today's discussion that will also be followed on Saturday with a hands-on hybrid workshop at ISCM by Lothikha. I hope that these will kickstart this year 2026 with a great emphasis on health for the women who are the true Shaktis. Swamiji used to play on the word Thai because Thai is the month that has begun. Thai and Thai. Thai means the mother. The maternal is the Thai. So in Thai, we are talking about the Thai Kulam, which is our woman folk. So looking forward to a wonderful evening, and we'll be back with you a little later to discuss about Gita and also have that surprise that Nilachal said we are releasing something today, which I hope you'll all enjoy also. Let's have a great evening. Namaste, Dhanyavad, Nandri Vanakkam.
Thank you, sir. Thank you for this guidance. And one thing really, while we were in the ashram earlier last year, there was one, like we were having conversation, and I had a discussion with Diyadi regarding this, like when we were going with you in the car, and we were going to the Kamli Swami Madam. So that is a destination. And once we were going with you to watch the movie Superman also. So, so both the places are there. So we are guided by you in different ways. And thank you for providing that opportunity and the guidance, which help us to not only grow but evolve in many ways. So thank you for this. Now, coming with the session that we all are looking up, and the very first session of this webinar is like what women commonly face across life stages. And to ground today's discussion in clinical reality, I now invite Dr. Lothikha, who will speak about the common health challenges women face across different stages of life. And before that, I would like just to read a basic intro about her so that you all know about her. So Dr. Lothikha, she's an assistant professor in the Department of OBG, Saveetha Medical Hospital, College and Hospital in Chennai. And she is an experienced obstetrician and gynecologist dedicated to women's health, integrating evidence-based medicine with yoga therapy. She has an understanding of yoga therapy, meditation, and all. Currently, as an assistant professor, she is working at SIMATS Medical College, Chennai, and she previously worked as a junior consultant at Apollo Gleneagles Hospital, Kolkata, and has extensive experience in obstetric and gynecological care. She completed her postgraduate training at Medical College and Hospital, Kolkata, and earned her MBBS from the PIMS, Puducherry Institute of Medical Sciences. Known for her calm demeanor and compassionate care, she has safely delivered thousands of babies and is trusted by women and families. In addition to her medical practice, she is a dedicated yoga practitioner utilizing Nada Yoga and Chakra meditation to promote emotional balance and quality of life for women. Her approach blends modern medicine with yogic principles, positioning her as a credible voice in integrative women's health education. So, with these qualifications, we are going to listen to her. So, I'd like to invite Dr. Lothikha for this session. And just a minute. Uh, uh, I have to share this.
Welcome, everyone.
Yeah. Yes, Dr.
Am I
Lothikha.
audible?
Yeah, please. I'm just sharing the screen. You can start, please. Yes. Over to you, Dr. Lothikha. You can see the screen, Dr. Lothikha.
Yeah.
Yeah. Please continue, ma'am. I think there is a network issue until she joins. Just to give an idea about in between, if we have any questions related to this session, please write it down. At the end, we will have a question answer session also. We'll be taking the question from the audience as well. So keep writing them down and you can ask a question at the end. And after this, we will have another session of Dr. Shamili ma'am, who will be discussing about the pharmacy and other medicines that we all take. So Dr. Lothikha has joined again. Yeah. So over to you, Dr. Lothikha. I hope this time your internet works well.
It's mute.
Can you please share the screen? Thank you. Vanakkam, everyone. I'm Dr. Lothikha, Assistant Professor. I'm working in Saveetha Medical College in Chennai. Very grateful for this opportunity which has been given to share my experiences with you all. Now, before I start this topic, I want to set the tone by saying women We learn very early to going. Women late, just what they were saying, everybody else's health before hers.
Dr. Lothikha, sorry to interrupt in between. I think your network has again some issues. If you want to take some time, you can come back again and we can rejoin and try with the internet. I think, yeah, she has. So, so we'll take here a pause, and I would like to, she joins. I think we'll try one more time if that works. And I would like to invite after that Dr. Shamili ma'am, so that like she resolves her internet issues. Dr. Lothikha ji, can you check? So we all are at the mercy of the internet god. So sometimes it works, sometimes it doesn't. So it's completely not in our control, but it's fine. So I request you all to stay tuned, and uh, and I have seen the PPT that Dr. Lothika has prepared. It is wonderful, and yeah, internet got busy with Pongal celebration. Yes, Balaji sir. So now I'd like to invite Dr. Shamili ma'am in this time till the Dr. Lothika get her things and internet issues resolved, and would like to just share. Uh, and before starting it, I would like to read her bio so that in between, uh, just give a minute. So Dr. Shamili ma'am, she is a doctor, she's a pharmacologist and general physician, PIMS Pondicherry. So Dr. Shamili Shankar is a medical professional currently pursuing her MD and at PIMS, and she holds an MBBS degree from AVMC, uh, Arupari Vidu Medical College and Hospital. She brings with her significant clinical experience, having worked as an emergency medical officer for 4 years and as a junior consultant in cardiac critical care for 2 years, where she was actively involved in acute and critical patient management. Her areas of professional interest include critical care services, adverse drug reaction monitoring, pharmacokinetics, and pharmacovigilance, reflecting her strong focus on patient safety and rational drug use. And born and brought up in Gujarat, she later moved to Pondicherry for her medical education training. Her diverse academic and clinical journey has shaped a balanced perspective that integrates frontline critical experience with academic pharmacology. And she is wife of Dr. Balaji sir. So both forms a duo doctor. So we have a very good opportunity to listen to you, ma'am. Over to you for your presentation.
Thank you. Thank you for such a beautiful introduction. Nilachal ji, is Lothika presenting or shall I start
Ma'am,
my presentation?
yeah, ma'am, please, you present still. Lotika ma'am has her internet issues, so she is
Okay.
connecting with that. So I request you to please have present your session so that till that
Yeah,
time.
1 second. Yeah, 1 second. I just share my screen. 1 second.
Yes, Nalini ji, internet god is afraid of Shaktis. That's why it is happening. So too much power, it is difficult to bear. So we have this thing happening here. Yes, Shamili ma'am, your screen is visible. Uh, please make it full screen. Yeah, perfect. Over to you, ma'am.
Am I audible?
Yes, ma'am, you're audible.
Yeah. Okay. Okay. So today we'll start with the second session first because of the internet god, as you all said. Today my topic it is about medicine and women's health. So the clinical aspect about the women's health, I think Dr. Lothika will be she will be better in that. But I will say the pharmacology angle, so the perspective from a pharmacologist angle. So when we hear the word pharmacology, so what people think like the complex drug names and clinical trial, hospital settings and all. So, but today I just want to keep this session as a very simple and a practical session. So this talk, it will be mainly about the medicines. So mainly the medicine which revolves around the women, which we use in everyday life, such as the painkillers, iron tablets, antibiotics, birth control pills, herbal remedies, and like supplements like that. So the basically my goal is not to scare away from the medicine. So, but it is to help so that we can use it wisely. That is at the correct time, so correct way, and at the correct stage of life. So, having said that, we'll move on with the presentation. Yeah. So, I'll just want to start with a very simple question. So, from teenage years to old age, how often does a woman use medications? So, it will start from periods, pregnancy, anemia, headaches, mainly infections, menopause, and after menopause, the back pain, bone health issues, and all. So we are like surrounded with medications, and women almost use medication throughout the life. And here the problem is that our health it keeps on changing. So what works at 25, which it may not work at 45. So that is what we have to understand. So we have to understand another angle is whatever the medication is safe before pregnancy, it may not be safe during the pregnancy and breastfeeding also. So this is something what most people don't know and but what most people should understand. And one more important thing which I understood uh, after so one more important thing which I understood after learning about getting into pharmacology is that most of the medicines, whenever the clinical trial is done, it is basically tested in men, and women's bodies are often ignored. And similarly, the data on the breastfeeding women, the lactation is also not much done because they all fall under vulnerable population. So that data is also very less only. So we should know there is very little knowledge which is present about the women's health regarding medicine. And if we gain some knowledge about that, we can make a better health decision. So the big picture is why women are different. That that is the one thing which we should be very clear is so women's body it is not like a smaller version of men's body. So it's like they are very small than men. So it is not like we are similar to men. We experience more side effects compared to men. That is almost 1.5 to 2 times more than men. Why? Because the main culprit here is hormones, because hormones it changes in every not month, actually in every week. So every week there are some hormones which play inside a woman's body. I'll not go to in the technical terms, but every week there is different hormones which act in a woman. So there is a change in every month, every year, and even across the life. So because of this, they have a very big effect in the women's body. So the medicine also it has a very important effect because of the hormones. So, but the thing is, if we understand this, we can avoid many unnecessary problems and we can make a smarter choices. So the basic biological difference we have to understand, because of which many diseases are more frequently more in men, in women, and even the difference is also there in women, like arthritis, breast cancer, cholecystitis, endocrine disorders, obesity, pelvic fractures. They are more common in women compared to men. And this difference, it is mainly due to chromosomal distinction. Okay, the difference between the chromosomes and hormones, as we said, like estrogen, progesterone, etc., etc. So these hormones, they decide how the medicines will be absorbed, how it can be broken down, or how it will be removed from the body. So we should understand a very important thing here: the biology which takes place, it is never a weakness for women. Okay, so it is only a biology which, because of which the medicines act differently. It is never a weakness for women. So this itself, this understanding itself is very important for protecting ourselves, for protecting the women better. So we should understand how women's body they process the medicine. So I will just explain with a simple example. So if we are imagining we are pouring a same amount of coffee in 2 cups, but here the size is different. 1 cup is large and 1 cup is small. So the smaller cup, it will fill much faster. So similarly, a woman's body, when they have, because of the lower body weight, and there is a higher body fat content. So because of this, the same medicine, the same tablet, it can have a stronger effect in the women. And another factor which I'm going on saying, the hormones, it can also speed up or it can slow down the processing of medicines. And again, with age also, the kidney will start to slow down, the liver will start to slow down, and the chances of medication of staying longer in the body is more, which can lead to toxicity and side effects. So because of this, the same dose, it may not suit for every woman at every age. So this is why we should understand that women's body, they process the medicines differently. So we'll see about the life stages which a woman passes and how the medicinal needs change with each life stage. So let's talk about young women and girls. So the young women, they start taking medications very early in life, like starting at the age of 12 to 13 for periods pain, for acne, for anemia associated with excessive bleeding, for many hormonal issues. And throughout the reproductive age, there is a chance the women take birth control pills. And because of here, the painkillers, they are like most commonly used for periods pain. Occasional use is fine. But if you are taking it frequently without a proper advice from the physician, it can affect various organs. And if the pain is very severe every month, we should understand that it is a signal the body is giving that something has to be evaluated. And the pain, it should not be subsided with just a tablet. Something internally is happening because of which there is excessive pain which is happening. So that is just a sign which we should not like contain it with a tablet. So that we should always understand. And the main issues which I want to tell is about the birth control. So we have to watch for drug-drug interaction, which is very, very important. So some things which will make a birth control pill stops working. And the main thing which you will understand is certain antibiotics like the TB medications. It will speed up the pills, like how it will be broken down. And some herbal products like a drug called St. John's wort. It is used for mood problems. So it can reduce the effectiveness of this OCPs. Similarly, some epilepsy medicine, some seizure medicine, it can also interfere with the uh, working of the birth control pill. So if we are taking both of them together, what will happen is the birth control pill will not work and it will end up having a unwanted pregnancy. So here the solution is very simple, that we have to always tell the doctor like what all the medications we are taking. So this can guide us for having a backup protection also. Our next stage I'm going to talk about is the pregnancy and lactation. So during pregnancy and breastfeeding, the first and the foremost priority is the baby. So the safety of the baby is very important. So as much as possible, we have to avoid taking medications. So the natural remedies, they can come like first for when the women they experience nausea or the morning sickness, ginger tea, like vitamin B6, pressure bands on the wrist, they can work very beautifully. And some medications are safe, which we should know, like the prenatal vitamins, some pressure medications, medication for diabetics. So they are very necessary for the well-being of the mother and the child. So that has to be taken. So without proper knowledge, if we avoid that, that will also create a problem. And some painkillers and antibiotics should be strictly avoided. So all this we have to assume that a medicine is not safe. And it is not safe just because we have used it before pregnancy. So we have to always clarify with the doctor. Coming to the next stage, we are going to talk about is menopause and the later after this. So menopause, we should understand that it is a natural stage, and here many health change happens because the hormone level will go on decreasing. So there is various symptoms like hot flashes, mood swings. There will be sleep issues, which can be very much troubling, but they can be manageable. But we should not go to medicine straight away for that. Various natural options are available. And there is a herb called black kashosh and a sage tea, soy foods, which has natural estrogen, little bit of natural estrogen, yoga, regular exercise. They can be helpful for containing the hot flashes and the mood swings and all. And exercise alone, there is a literature review which shows that exercise alone can reduce hot flashes for up to 40%. So it can be very much manageable with natural remedies. And if needed, it's when it is absolutely needed, hormone therapy, hormone replacement therapy can always be taken, and it should be tailored according to the individual by a proper doctor. So now we'll see when the medicine will become too much. So, like when there is a common habit, like if there is a little bit discomfort, we go for painkillers. Any mild toothache, we go for painkiller. If there is a mild cold, we go for antibiotics. Most of the cold and all, it will be viral, but still we go for antibiotics. And taking multiple health supplements together. If we are feeling very tired and everything, we go for taking vitamin injections. So there the medicine, it will be overloaded and which can lead to various harms. And side effects, they start appearing very slowly because we are taking it for a longer time. So people don't connect them to medicines. Okay. So here the solution is really simple. That is lifestyle changes, rest, stress management, and that can be tried first before going for a medicine. So here we should understand why women they get more side effects compared to men. As I said before, the chances of getting a side effect compared to men is almost 1.5 to 2 times more. So why this happens is because of the biology. As I said before, the body size, and women tend to take multiple medications. So because of that, there will be drug interactions. And here, because of the innate biology itself, some drugs will alter the heart rhythm of women. So it can cause irregular heartbeat. So that itself will lead to more side effects. So here, I'm going on saying the fix is very simple. We have to consult our doctor before we take any medication, including the herb and supplement also. It should always be consulted by the doctor. So I have to talk a little bit about the natural and alternate medications. From previous slides also, I'm telling about the natural medications which is available. So the natural, many women, they trust traditional and natural systems of medicine. So because they mainly focus on the balance, I feel they more focus on the balance and mainly the prevention part. So which can be very useful, mainly for long-term wellness. But one thing we should always remember this: nature does not always mean harmless. So the herbs can also interact with the medicines which we take. So we have to use them wisely and accordingly. Ultimately, women as decision makers, what we often do is we always take care of the family first, and we make all the health decisions about the family. But when it comes to ourselves, we always hesitate, we always forget about it, and we always delay it, tolerate it, ignore the symptoms and all. But here I want to say that we also deserve the same care and attention that we give to others. So we have to be very much informed, like we have to be very much confident, and we should always ask some questions, which I have listed already. Like what life stage I am in, what changes are going on inside me. So if I'm having any disease or any condition, are there any safe natural options available? So we should always think about that first. And if I'm pregnant or breastfeeding, is this safe for me or is it safe for my baby? So we should always ask this question. And if there is a herb which I should avoid, or do I know everything about the herb? So that I should always question. And I should know, like, how I know if I'm taking a medication, how I know whether it is working or not. I should not go on taking the medication without knowing whether it is working or not. So these are all the smart questions we should ask. We should always ask so that we can be our own health advocate. So the final take home message I want to tell that we should always remember that medicines are a very powerful tool, but we are the controllers of that. So every medicine, if we open the pharmacology book, there each and every medication there is a separate heading about adverse effect. So all the medication has a side effect, but the benefit is when we take the medicines when the benefit is more important. So in spite of being a powerful tool, we are in control. So one medicine, it will not fit for everyone. That's why now the more research is going into pharmacogenomics, personalized medicine, that each and going for each individual, they are tailoring the treatment separately. So one medicine, it will not fit, does not fit for everyone. And the nature and science, they work best together. I'm not supporting the science always. So it's always nature and science. It should go hand in hand. And we have to talk openly with our physician. And as I said previously, if we are at age of 25, the same will not be applicable at the age of 50, and that is very much normal. So here the goal is for better health. So through knowledge, but not with fear or ignorance. I'd like to thank you. So I'm ending this session today. Thank you for listening, and I'll thank Swamiji and Ammaji and Ananda sir and Devasana miss for giving me this opportunity, for accepting me and giving me this opportunity. I thank Nilachal ji for organizing this webinar and Dr. Lothikha for sharing the talk with me. And last but not the least, I want to thank my husband, Dr. Balaji. This is my first webinar talk I am giving, and he will always insist me to do all this. But this is the first thing, and this is, I think he will be the happiest man today. Thank you all.
Thank you so much, Shamili ma'am, and it was wonderful. And we'll get back to you again with a lot of questions and seeking some more answers. And we have with us Dr. Lothikha again, and with a better connection. I hope the internet is now able to bear the energy that Dr. Lothikha has. So, and just to let you know, recently we had a dance drama, and she played the role of Ma Parvati and also Mohini. So double energy she has. So we saw the impact we had today. So all the Shaktis are here. So without taking much time, uh, uh, we are going to dive into this another session. And just to give you a brief, it is going to be a wonderful one. So stay tuned. Yeah. So here is it. Just you have to tell me next, and I will change this slide, Lothikha ji. Yeah.
Welcome, everyone. And thank you again for this opportunity which is given to me. Um, really love what I am doing, and to share it with you all is a very good blessing for me. So I was saying that I want to set the tone for today's talk by saying women has always delayed her health because she has always put the others' health before hers, like Devasana Miss has told. Today we are going to talk about her health, whom which she has always delayed, which she has always neglected, which she has learned to tolerate and ignore, which she has learned to adjust instead of asking. Starting with what we commonly face in our day to day life. Next slide. Next slide, please. Can you please change the slide?
Yeah, yeah. Just a minute. Uh, Is it visible now? No? Just a minute. So there are a lot of internet issues. So yeah, I think it is visible now. Yeah. Is
The
it?
previous slide.
Yeah.
The previous slides. Before, the previous one. Yes. Yeah. Let me start with what we encounter in our day-to-day lives. First, the most common symptom that most patients present to us with is abnormalities in their menstruation. It can range from an irregular menstruation or a delay in menstruation or a missed period or heavy menstrual period or decreased period. Now, before understanding why these patients present with these complaints, let's have a small knowledge about what the menstrual cycle is. Next slide. The menstrual cycle in a woman is a beautiful orchestration, a beautiful communication that happens between three parts: the hypothalamus, the pituitary, and the ovaries. In They are set in a job to prepare the uterus for pregnancy. From the hypothalamus, a particular hormone comes, which is called GnRH, which goes and stimulates the pituitary, from where two hormones, FSH and LH, are released, which in turn goes and stimulates the ovaries, which release estrogen and progesterone. Now, these two hormones are responsible for making changes in the endometrium to prepare it for pregnancy. The next slide, please. Yes. So we all know. To understand this menstrual cycle, let's take a simple 28-day cycle because it is easy to understand. The first 3 to 5 days, it's going to be menstrual bleeding. And the 5 to day 14 is called a follicular phase. The predominant hormone is FSH. The FSH recruits the follicles. That is, it goes around picking the healthy oocytes out of the number of follicles picked. One follicle becomes a dominant follicle. From that dominant follicle, we have a particular hormone called estrogen. After estrogen rises, LH surge happens. LH is another hormone which is coming from the brain. When LH surge happens, ovulation happens. Once ovulation happens, a corpus luteum is formed from where progesterone, another hormone, comes. Now, this estrogen and progesterone prepares the endometrium or the uterus for pregnancy. Now, if the pregnancy doesn't happen, in which case the follicle dies and the estrogen and progesterone drops, the levels of the estrogen and progesterone drops. As a result, the endometrium starts shedding, which we see outside as a menstrual blood or a menstrual cycle. This much is menstrual cycle. Now, for a healthy menstrual cycle or for a regular menstrual cycle, this HPO axis, the three hypothalamus, pituitary, and ovarian axis, the communication between them plus the endometrium should be in a functional state. Only then can a woman have her regular menses. Now, next slide. Now we have a range to call it normal. For me, maybe a 28 days, I have a regular 28-day cycle, maybe 28 days is normal for me. But another woman might have a 30-day cycle. So you consider 30 as abnormal? No. So we set a range. A range between 24, somewhere between 24 to 38 days is considered a normal frequency. If it is less than 24 days, we call it a frequent cycle. If it is more than 38 days, we call it infrequent cycles. And if there is no period at all for a period of 1 or 2 months, we call it no menses or amenorrhea. Bleeding of up to 8 days is considered normal. If your bleeding goes more than 8 days, we call it prolonged menses. about regularity, we women think that if you're bleeding, say January 2nd, your next period should come on February 2nd, which is not the case. If your cycle, the difference between the longest cycle and the shortest cycle, if the variation is somewhere between 7 and 9 days, then it is considered a decent regular cycle. Now, to calculate your longest cycle, shortest cycle, you should have a minimum of 6 months in your hand, 6 month cycle in your hand, calculate the number of days. The longest to the shortest cycle is between 7 to 9 days. It is a regular cycle. You don't have to bleed the same date every month, which is a complaint that people come to us with. As far as flow is concerned, some women have light flow, some women have heavy flow. Heavy flow, we don't quantify heavy flow. We don't say that 80 ml or more than 80 ml as we used to say before. Now, the current definition says that, the current recommendation says that any amount of bleeding which is going to interfere with the woman's physical, social, emotional, material quality of life is considered excessive bleeding. It can be for 3 days, it can be for 5 days, but if it is going to interfere with her quality of life, we consider excessive amount of bleeding, and that needs attention. Next slide. So, what are the most common complaints menstrual complaints that patients come to us with? Like I said, some women have missed periods, amenorrhea. Some have frequent menses, meaning every 22 days or 10 days she's having a bleeding. She bled twice a month. Sometimes she can have heavy bleeding associated with clots. Sometimes she typically gives us complaint where there's excess bleeding. She changes, say, 5 to 6 pads a day. Sometimes women even says, "Ma'am, I have to finish one entire pack a day." That much bleeding she might have associated with clots. Then it rings a bell that it is a heavy menstrual bleeding and there's an underlying condition. Apart from that, there is oligomenorrhea where very light bleeding she has. She hardly needs to keep a pad for that bleeding, or maximum one day she bleeds, which is still a complaint for her, which needs attention as well. So, what are the underlying conditions we commonly face is, of course, first is PCOS. More than 50% of the population who come to our OPD have PCOS complaints. Apart from that, and this is usually, which range I can put is somewhere 14 years to 41 years. I have seen a 41-year-old woman with full-blown PCOS as well, and another girl, young girl with 13 years, 14 years, just attained menarche, coming with PCOS as well. So we are going to have a full, beautiful discussion on PCOS later. I'm not going to spoil that for you here. Apart from PCOS, there are certain structural uterine abnormalities like a uterine polyp, a uterine fibroid, a uterine adenomyosis, malignancies, which can also cause abnormalities in your uterine bleeding. Apart from all of that, the lesser common causes, the lesser common patients we see are women with the bleeding disorders. Bleeding disorders means where the clotting factors, the blood clotting ability is poor, as a result of which they have abnormal uterine bleeding. They are relatively lesser. We have iatrogenic causes, meaning a doctor has given a pill because of which she is having an abnormal uterine bleeding. What pills can they be? Antipsychotic drugs, because there is increase in prolactin using antipsychotic drugs, they can have absent period, which can be a problem for them. Steroid injections can cause steroid injections for any reason, say any autoimmune conditions like SLE, rheumatoid arthritis. If she's been taking long-term treatment, long-term steroids for these drugs, can also affect your menses. So these are all iatrogenic causes for abnormal uterine bleeding or the abnormal complaints in the menstruation. Next slide. But another complaint is dysmenorrhea or pain during menstruation. But here I have said that pain is a good sign. How come? Because pain is that sign which gives you a strong push to go and visit a doctor. Pain anywhere in the body. That rings a bell that yes, there's somewhere pain, I have to go and check. Heart pain, you have to go check. Heart pain with somewhere a shoulder pain, then you get scared yourself. So pain is usually that symptom which pushes the patient to go to the doctor right away. But in period, during menstruation, we have two types of pain. Next slide, please. Yeah. One is called primary dysmenorrhea, and the second one is secondary dysmenorrhea. Primary dysmenorrhea means an ovulatory cycle. That is a woman has been having a normal, regular ovulatory cycle. She's been ovulating regularly. As a result of which, during shedding, during her menstruation, there is prostaglandins. Prostaglandins are chemicals which causes some uterine contraction, as a result of which she feels pain. There is no underlying pathology. It is simply an ovulatory cycle, and the prostaglandins are released from the endometrium as a part of shedding. Hence, there is pain, no underlying pathology. And there is another kind of pain during menstruation, which is because of an underlying pathology. When there is an underlying pathology, there are different kinds of pathologies are there. Say in early reproductive years, endometriosis is a very common cause of late. Now, what is endometriosis? Endometriosis, we have only given theories of what endometriosis is. Why it happens, not many people know. But endometriosis is a condition where your menstrual blood, which usually comes out through the cervix, through the vagina, which you see visibly outside, sometimes can retrograde, go through the tubes, and can get deposited inside your abdomen, inside your peritoneum, in the intestine, or whatever structures are nearby, can cause pain every single period. This is endometriosis. Endometriosis is one common complaint which patients come to us with. And second is uterine fibroids. Say in the mid 30s onwards, patients come to us with uterine fibroids, uterine adenomyosis. These are all structural conditions which can result in pain. So pain brings the patient to us, so underlying pathology can be found. Now, when I say it's primary pain, primary dysmenorrhea, where there is no underlying pathology, would you want to treat them or not? Because there is no underlying pathology. Now, let me put this out here. Normal does not mean it is tolerable. And tolerable does not mean it is healthy. No pain needs to be tolerated. If it is creating any difference, if it is creating any discomfort, you'll have to check it out. How do we find the difference between primary or secondary is primary usually starts along with the menses. So suppose today is your day 1 of the cycle, today your pain starts and usually peaks around day 2, subsides on its own. Mostly people can bear this pain. Most of the women who I'm seeing in the OPDs can usually bear this pain, or at the maximum would need 1 or 2 analgesics, basic analgesics like mefenamic acid, paracetamol to subside the pain. In the case of a secondary pathology, this pain usually starts at least 1 week before the menses itself. 1 week before the menses, it will start. It might persist through, or it will persist through the period, and it might continue even after the menses has stopped. Now, this is your secondary kind of a dysmenorrhea. She will give you a typical history. She will say you that the pain starts even before the menses starts, and it is still there. My menses ended, but it is still there. It is still hurting for me. It is right here. She will touch her lower abdomen and she will show you it is still there. It is still persisting, and it is very intolerable. Not able to do her activities at all. Not able to do her routine activities at all. This kind of a pain is usually associated with an underlying pathology. Next slide. Another very common complaint is vaginal discharge or leukorrhea. Before going to what are abnormal. What is an abnormal discharge? I'll tell you what is a normal discharge. Because these is the complaint which patients mostly come to us with without knowing what is a normal discharge. So if your discharge is cyclically changing, meaning the first half of the cycle, I said it is estrogen predominant, and the second half is progesterone predominant. That is the follicular phase, estrogen predominant, and the luteal phase is progesterone predominant. So this estrogen influences the cervical secretions, and as a result of which, your cervical or the vaginal secretion that you're seeing is usually clear, sticky, and when you move it in between these two fingers, it is stretchable. It's stretchable without breaking, which is called a spin bar heat test. Anyways, so if it is clear, it is stretchable, not foul smelling, it is usually in the first half of the cycle, it is normal. And the second half of the cycle, the same vaginal fluid changes in consistency. It becomes more thick, becomes like a cervical mucus plug, and it becomes more white also. That is because of the progesterone. Progesterone influence makes it more thick. Purely nature's play. Why is it thin and why is it thick? In the first half of the cycle, when the chance of sexual intercourse is more, to facilitate more sperm inside the female genital tract, the cervical mucus is thin. And the second part of the cycle, where the nature assumes that there is a pregnant fetus inside, the progesterone influences the cervical mucus to become thick, forms a thick mucus plug. So ascending infections doesn't come inside and infect the baby inside. So this is normal. If it is cyclical, if it is only this much, sometimes yes, it can. You can see that in your underwears. It can wet your underwears. It is still normal. If the same discharge is associated with itching, is associated with foul smell, or there is any change in the color of the discharge, then it is considered abnormal. Like how you see here, there is a white color discharge. So in typical fungal infections or yeast infections, what you typically see is a curdy white discharge. In a fungal infection, what the more than the discharge, the itching is more intense. Patient complains of intense itching more than the discharge. That rings a bell that it could be a fungal infection. Secondly, if it is a yellowish green color, it is mostly a trichomoniasis infection. Trichomoniasis is a parasite. Trichomonas vaginalis, we say. It's an infection which is mostly or is sexually transmitted infection. So you diagnose it rightly, you give antibiotics, it is treated. And because it is sexually transmitted, both the partners have to be treated in that case. There's another condition called bacterial vaginosis, where the vaginal discharge can be white, sometimes grayish, and it gives a typical fishy odor. That is bacterial vaginosis. And why bacterial vaginosis happens? Because of an imbalance in the bacterial flora in the vagina. Vagina has its own commensals, mostly lactobacilli. But if for some reason the lactobacilli goes down, the other normally living bacteria, they rise up, they start causing infection. This is called bacterial vaginosis. Again, when diagnosed at the right time with adequate antibiotics, it can be treated. This is by and large the common causes of vaginal discharge, which we see in our practice. Next slide, please. Yes. This adolescent age is where you can nourish them to have a better health in the future. Adolescent age is for nurturing the future health. That adolescence is somewhere between 10 and 19 years of age, where secondary sexual changes start, where they start having their own gender identity. They question things, high risk taking behaviors. Because of that, there are certain health concerns. Different ages of women face different challenges. Let's see what this adolescent health, which is most vulnerable population, what health issues they face. Can you please change the slide? Yes. They have just started menstruating, 10 years, started menstruating. The HPO axis that we spoke about is still immature in them. It takes around 3 years to mature. By 3 to 4 years, 50% becomes a ovulatory cycle, but it takes some time for this HPO axis to mature. So most of these young girls will have menstrual abnormalities, dysmenorrhea because of the same reason. They can have vaginal discharge, obesity, because of their risk-taking behavior, because they are very curious to explore everything, because of peer pressure, social media, they are all prone for unwanted pregnancies, sexually transmitted infections, micronutrient deficiencies, and anemias because they want to eat what is fancy, what looks good to them. And more westernization, more such diet is what the young population is taking. And they are also more prone for sexual abuse because now I am facing this population quite frequently in our practice, and it is my duty to put it out there because this population or this child is not going to come and ask you for your permission before getting exposed to all these things, before those unwanted pregnancies are going to happen, before the STDs, before she's going to take a decision for which she might regret later. But it is our duty to educate them on contraception, on sexual health, what is good touch, what is bad touch, what is necessary, what is not necessary, about her body changes, about how to feel good about herself, you know, because these women, these girls also face a lot of depression and anxiety. So it is our duty to not judge, but educate them on this area, especially contraception. And yeah, next slide, please. There are lots of government-run programs, especially this one, where menstrual hygiene is practiced. Menstrual Hygiene Day is celebrated on 28th of May, and the common population that is targeted is the adolescent population, where they teach with the help of ANMs, that is the community workers, community health workers. We call them ASHA, ANMs, BHMs. They come, they go house to house, make sure the adolescent girl has got her supply of sanitary napkins for the month, teach them how to use it, how to discard it, and everything. So we have good government NHM run programs, which is focused especially on adolescent health. Next slide, please. PCOS. Now, PCOS is, like I have put here, it's a rising epidemic. PCOS, what is PCOS? It is polycystic ovarian syndrome. It used to be called a disease because previously our understanding was the PCOS or all the manifestations of PCOD was because of anovulation. That is, there was no ovulation because of the ovaries, because of some issues in the ovaries was what the idea was before. But now, with adequate studies, we have understood that it is a lifestyle problem. Lifestyle, the diet, the stress, and stress which is directly related to gut dysbiosis. Gut dysbiosis in stress or obesity, what happens is the gut bacteria, the bacteria which are supposed to be inside the gut, they come out because the permeability is increased. And now when they come out, they cause insulin resistance. So all these changes together, along with genetic predisposition, create an environment of insulin resistance. And insulin resistance, it hampers the glucose metabolism. It causes hyperandrogenism. Hyperandrogenism means the male hormones in the female body, which are there, which are in very minimal amount, which is needed. But because of this insulin resistant situation, the hormones are increased. hormones are increased. So there is hyperandrogenism. Now, so as a result of all this insulin resistance features, the other manifestations of PCOS comes. The other manifestations of PCOS includes irregular menstrual cycles. There can be weight gain, especially central obesity, difficulty in losing weight. There can be excessive hair, which is called hirsutism, which is because of the hyperandrogenism or increase in the male hormones, the androgens. As a result of which, again, there can be acne. Acne also can be because of hyperandrogens. Some people manifest with infertility, difficulty in conception. Now, endometrial hyperplasia. What is endometrial hyperplasia? We are now facing a population which is undergoing early menarche, meaning they are achieving puberty at a very early age. And on the other hand, they are achieving late menopause, which means their menopausal age is also delayed. Now, throughout this period, because there is no ovulation or anovulation in PCOS, these women are being exposed to estrogen, which is a predisposing factor for endometrial cancer. That is endometrial hyperplasia is a pre-malignant condition. Let me repeat again. Can you please show the previous slide? Yeah. They have irregular menses because they don't ovulate. They have weight gain because of their lifestyle, because of insulin resistance also. Now, because of insulin resistance, there's also metabolic syndrome-like features. Metabolic syndrome includes hyperlipidemia, your fat levels go high, your blood sugar shoots up, your BP shoots up. There is central obesity, proper, where the waist, hip to waist circumference ratio increases. They have very high difficulty in losing weight. Apart from that, they also face a lot of psychological complaints like depression. There is obstructive sleep apnea. There is vitamin D deficiencies. These are also other PCOD symptoms. Please next. Next slide, please. These are the common skin changes. Previous slide. These are the common skin changes that you can quickly diagnose PCOD or any insulin resistance conditions. In the neck, in the flexor aspects, in the neck, armpit, inner thighs, there is a similar blackish discoloration that you see here, which is called acanthosis nigricans. There is male pattern hair loss or alopecia. Male pattern means especially in the temples, in the frontal region, there's going to be hair loss. Acne, like you see here, and something called hirsutism, where there is male pattern hair growth, where there's more hair growth in the upper lip, the chin, the cheek, the chest, the abdomen, entire body. That is hirsutism. So these are the skin manifestations that you can diagnose a PCOS with. Next slide, please. Next slide, please. Yeah. Okay, so for diagnosis of PCOS, you need three things. One is irregular menses. The second one is the hyperandrogenism features that we just saw. The skin changes like acanthosis nigricans, the male pattern hair loss, the hirsutism where there is male pattern hair growth, there's acne. This hyperandrogenism feature should be there. And the third is, in your ultrasound, if your ovarian volume is 10 or more, 10 ml or more, again, that is also suggestive of PCOS. But we don't need all the three for the diagnosis. If 2 out of these 3 features are there, we are still going to diagnose them as PCOS. 3 features were ovulatory dysfunction or irregular menstruation, hyperandrogenism, and ultrasound features of polycystic ovaries. 2 out of these 3 should be there for diagnosis of PCOS. However, the mainstay treatment for PCOS is going to be exercise, exercise, and exercise. The best exercise is the one you enjoy doing. Yes. You give them what they like the most to do. If they like going for walking, let them go walking. Swimming, cycling, skipping, yoga, aerobic exercise, Pilates, whatever they like doing, but make sure the patient is moving. Along with that, along with exercise, make sure the diet is also correct. This is 70% of your treatment. Now, apart from the diet and the exercise, we give them hormonal pills, what we call in local terms as birth control pills or oral contraceptive pills. Works like wonders, which we usually give. It is safe if it is used under supervision. How we usually give is 3 months, I prescribe them with oral contraceptive pills, call them back after 3 months, redo all the investigations, see how she has responded to the treatment. And again, for another 1 or 2 months, I stop them from the drug, see if she is ovulating on her own, if the weight that she has lost has helped with spontaneous menstruation. If she's not menstruating, we put her on the drug again. Like this, 9 to 12 cycles per month can be, oral contraceptive pills can be used, but under medical supervision. It is said that at least 5% of your weight loss can help in spontaneous ovulation, spontaneous conception also. Apart from the oral contraceptive pills, of late we are using metformin because this is insulin resistance like features. We give metformin, which is an oral hypoglycemic drug, which is used for diabetes treatment. But because it helps in insulin resistance, we give for metformin also. We give metformin for PCOS also. Next slide, please. Fertility changes. In one menstrual cycle, our ability to conceive is only 20%. That is, if a couple is having unprotected sexual intercourse at the proper time of ovulation, if they're having proper intercourse, then their chance of conception is only 20%. Otherwise, every month there's going to be a conception, and at the end of 1 year she's going to have 12 babies in her tummy. But nature wanted to avoid it and purposely has put that there is only 20% of chance of conception in one cycle. So at the end of 1 year of marriage, 80% of the patients conceive, and at the end of 2 years, 90% conceive. Now, why am I saying this? Is most common complaint that patients, that newly married couple, they say 8 months of marriage, 6 months of marriage, and they come to us saying, I'm not conceiving. There's a lot of pressure in the family. There's some issue with them. There's some issue with them. I'm not conceiving. They are really tense about conception. So we give 1 year for the couple to try by themselves. In despite 1 year of proper unprotected sexual intercourse, if they are not able to conceive, then that would need attention. Next slide, please. Before conception, it is always good to have a preconceptual counseling. The preconceptual counseling will help in understanding the health issues both the partners have to optimize all their levels. If the woman is having sugars, to optimize the sugar levels. If she's having BP, optimize those levels. Stop alcohol, stop smoking, whatever habits or addictions they have, to optimize everything and to achieve a safe pregnancy. Minimal tests also we do, but it is always better to attend a preconceptual counseling before conception. Next slide, please. Every woman should undergo certain screenings in her lifetime because the breast cancer is the most common cancer, first most common cancer in women, followed by cervical cancer. And these two cancers can be screened, can be early prevented. First one is by doing self-examination. You stand in front of the mirror with the flat of your palms, you palpate your breast, you rotate, you look for any lumps or mass, squeeze your nipple, look for any discharge. If standing and checking for the mass is not possible, you can lie down and also check. And the most appropriate time for checking for breast examination is after your period, because at the time of the period, there can be breast congestion also. Apart from that, mammogram. Mammogram screening for breast cancer starts at 40 years. 40 years annually, women should undergo a mammogram examination so as to detect any breast cancer or any lesion in a much earlier age. Next slide, please. If you see any nipple discharges, blood discharges, any lump in the breast or armpits, then they're all warning signs for breast cancer. Apart from breast cancer, there is also screening for cervical cancers. cervical cancer screening starts as early as, next slide, please. Yeah, cervical cancer screening starts as early as 25 years of age. There are lots of tests which can be done. What is shown here is the pap smear, which we usually do, commonly do. You do a pap smear today, which is usually the cell cytology. If you do a cytology, then every 3 years you will have to do. If you do HPV DNA, so cervical cancer is caused by an organism which is completely preventable, and hence we start early screening. However, it's very common, but when early screening is started, it can be picked in the early age, and the cervical cancer can be prevented. So pap smears, HPV DNAs can help in preventing cervical cancer. And there is also a vaccine for HPV virus, which prevents against cervical cancer. HPV vaccine is given at the age of 9 to 14 years, can be given up to 45 years also. Before 9 to 14 years is the actual age where this vaccine is going to work. Up to 25, it may work. 45, for the benefit over the risk, we give HPV vaccination. Next. Next slide, please. Menopause is more of a biological phase, just like puberty, where the woman's body is going through a lot of changes because of new exposure to those new hormones. Now these hormones, they come down, and they face different symptoms of mood swings, joint pain, irregular periods, vaginal dryness, and memory problems. Vasomotor symptoms like hot flashes, mood swings come. Next slide, please. It is important for screening for osteoporosis in women as well. Screening should start 65 years of age. Biennial screening, which means every 2 years, once you will have to do an osteoporosis screening to look for your bone density. If need be, you'll have to start calcium and vitamin D supplementations. Exercise is no excuse. You have to exercise throughout. 65 years, when women are more prone for osteoporosis and falls and fractures, that is the apt age for screening. You can start as early as 40 years when you're starting mammogram screening, but should not miss after 65 years. Next slide, please. Next. So I hope it was meaningful and helpful. Yes, it is seen in perimenopause also. So like I said, it's a phase. As the hormones come down, the estrogen is one hormone, which is estrogen receptors are seen in a lot of places, in the heart, in the bones, in the vagina, and the perineum also most. So when estrogen withdrawal happens, there can be bone pain, there can be these mood swings also. Yes.
Thank you so much, Dr. Lothikha. And the floor is open for the question answer. And as we are running out of time, the panel discussion that we have planned, I think we'll be taking it up in the next session that we have in the hybrid mode on 17th. So again, we have a lot of things coming up, and why this session was very much important, you all came to know, and it was a information with a lot of understanding and a lot of new things that we all should know. So thank you so much, Dr. Lothikha. And if you have any questions, you can put in the chat box, or you can raise your hand. I can unmute and you can ask your question. Anybody? Yeah. And before concluding it or going into the next part, I just want to have basic, if you have questions, you can keep writing. I'm just trying to have some questions if anybody has here. I just want to share a small personal incident which is very much relevant in this context. A couple of days, we had, as you all know, this is an event of GITA, and yesterday we inaugurated GITA and the Ananda Bhavan with the W. And as Dr. mentioned, we should not mess up with the Ananda Bhavan where the food is there. Here, the other food is there for the mind. So it wasn't planned in that way. So I had to stay back in Ananda Bhavan, and it was like mosquitoes, cold, and like those things were there. I tried to sleep there. And what stayed me with that place was literally something. Uh, it was very unusual, and it was nothing but the care. And I'd like to mention here, and I have to quote Dr. Ananda sir when he mentions gratitude without expression is a bounce check. So here I just would like to mention Dr. Lalita ma'am here, who is uh, dance, who has a Bharatanatyam dance music. She's a vocalist. She sings Carnatic songs and all. So she lives in Yogacharya Nilachal, and she called me to be in that place for staying in just to give a space, like why you are staying in that place where you have a lot of mosquitoes and all like that. The next morning, without being asked, she made sure that I had coffee. Although I don't drink, she made me a little different boost with the milk and all. Warm, she arranged warm water for the bath, towel, dhoti, everything needed to begin the day properly. No instructions, no obligation, just care. Why am I mentioning this thing here? She is not well. She can take rest and she can do her all things by her own, and it is not at all needed to do there. And this quality of unconditional anticipatory care is rarely taught and but deeply embodied by women. So this is what we have seen through these two lectures from Dr. Lothikha and Dr. Shamili. And this is the very instinct to hold space for another human being is something women quietly carry everywhere in families and institutions and society. And when this care is taken in for granted, women's health quite pays the price. And that is why today's conversation matters, and it is very important in this context. And with that context, if anybody has, yeah, there is a one question from Neeru. How can a woman prepare for menopause? What lifestyle changes do you recommend to have a smooth transition? I think this is for Dr. Lothikha.
Okay. So before menopause, there is a perimenopausal phase, which has to be very clearly understood, which usually starts around 6 years before her last menstrual period, her final menstrual period, and it continues 1 year after. So 1 year of no period, and then you look back and say, hey, you have achieved menopause. So this perimenopausal phase is important in a woman's life. She undergoes vasomotor symptoms. She undergoes bone pain, lot of issues with regarding that. There are heart-related issues also. And there's something called genitourinary syndrome of menopause, where there is going to be vaginal dryness. The intercourse becomes more painful, and libido comes down. These are all issues. Take healthy diet. Start your calcium and vitamin supplements as early as possible, as early as late for 30s only, I would say. Start your calcium supplementations and eat healthy. Just the normal healthy stuffs would do. There are certain phytoestrogens which are orally available, but it is available in all your natural diet as well. Just keep doing what you're doing. It's going to go good. Thank you.
Thank you, Dr. Lothikha. And if you have any more questions, you can keep typing and you can send to me directly. And we're moving to the next part that we all were mentioning in the beginning, that we have a surprise for you. For that, I would like to invite Dr. Ananda sir to come into the screen. And after that, I would like to invite Divya to just give an introduction about Gita. And I would like to share the screen. Just
While Nilachal is getting the screen ready, I wanted to say how much I enjoyed Shamili and Lothikha, your sessions. Very beautiful information sharing in a very beautiful, compassionate and accessible way. So thank you so much for that. stuff that you have shared in such an accessible way. I think that is very important. And again, I'm sure a lot will benefit from it. So it's very nice to see that. When we have begun GITA, we have our dynamic young Saglakala Valli, Natya Kalai Ilananmani, Divya Bhavanani, who is going to be one of the directors of the academy along with Ananda Balayogi Bhavanani, and hopefully they'll pay me a decent salary. So I think Nilachal has a good surprise for us, and I don't know what he is looking for, but he's looking for something online. Yes, so this is our Pongal present to everyone, the revamped new website for our Gitananda yoga activities. And this website has been put together by a very nice team that we have. And I would like to especially thank Dayanidhi, Mugundan, Nilachal and others who have put a lot of time into creating this beautiful contemporary website. And it has some very good information, including all the courses which are there. This needs a bit of updating, and we hope that all the courses can be accessed by people, because in our previous website it is tough to find where the courses are, and this way it will be a bit more accessible information about all the different institutions related to Yogacharya Satsanga, ICY, Kamli Swami Madam, with the Guru Parampara and the lineage, and information for those who wish to have that information in one place. Of course, the Yoganjali Natyalayam's performances, including the latest performances, and all the links are there for that, and some very nice, there's a nice classic photo from many years ago when Lothikha was still a kid. She may be in one of those photos someplace there also. And then of course the Gitananda Integrative Therapies Academy, which 9 years ago we conceptualized and now is coming to actuality with the beautiful team that is supporting this activities from all sorts. And this is a very beautiful background that is there at the academy. The logo is by Jeremy Dixon, one of Kalavati's students, who had designed it a decade ago for me, and is there. And the best part for me is now Yoga Life people can access it more easily online. So if you want to share links for people to download the issues, they can directly download it as a PDF. So this will become much easier for people to search it, find it, share it, and so more people can benefit from all the yoga lives that are there online. I think this is a very great component, and I hope that we will at least have the last. And then we have the. This is from the time of the Team 52, so we have to update the list of the mentors a bit more, because now there are a few more who are qualified for that, but this is the starting point. So those who are mentors for Team 52 are here. I've already given Nilachal a list of many more who have to come, and we want to make sure that courses they are running and events they are doing will all get showcased here. So this
for this list, Sangeeta ma'am helped me with getting all those lists. So thank you, Sangeeta ma'am.
Yeah, and we need to update it a bit more. There are another 4-5 people who have to come in, but it's a work in progress, and I think this is something that I've been waiting for it for a few years now. And nice to see this website that will be contemporary, accessible, and The one thing that we need to bring in and will be coming soon is a link to all the books and online books and other things that are on the icwire.in page. So that will be linked, and also I requested one page of my biodata so that it's someplace on the internet, because whenever people ask me for a copy of my biodata, I have to go searching for it. So it will be good to have a link someplace. But I would like to appreciate Mugundan, Daya and Nilachal for doing the amazing work in putting this together, and pleased to share with our worldwide yoga family today on this auspicious day of Makar Sankranti, Pongal and whatever we celebrate in different parts of the country. Thank you so much. I'd like to request Divya to say a few words. She's down with a bad cold, but despite that, a few words for all of us.
Namaste everyone. First of all, wishing you all happy Pongal from our side, from ICYR at Ananda Puducherry, and whatever festival it may be in your part of the world, wishing you the same, and greetings to all of you. Firstly, I think I would like to thank the Guru Parampara, all the Gurus, our wonderful ancestors, the different Gurus from the lineages that have come together, thanks to Swami Gitananda Giri. Moving on to, Ammaji, Dr. Sir, Devsnamas, and truly I feel beyond blessed to have been given the fortune to be born into this family, and not just being born into this family, but also being brought up by such wonderful people, my extended worldwide Gitananda family. And over the years, I'm really grateful for the acceptance that everybody has given me in the first place, for accepting me for who I am. And I think slowly, while growing into my own part, into my own role, I'm seeking the same from all of you as well, your blessings, your best wishes and your love always, because I know that being born into a family like this at times can be really stressful, and I'm a person that can really go on into a lot of overthinking. But beyond all that, I'm really looking forward to giving my best to Gita, and of course my congratulations and best wishes to Nilachal Bhai for making this possible today, because I think that initiative is very important, or else, as Dr. Sir said, it would have just remained a conceptualization from so many years ago. So thank you for bringing form into that today, and also looking forward to collaborating with my sibling, Ananda Balayogi Bhavanani. I like to call him my parents' second favorite child, but it's okay, he can take the first one. It's not matter, but looking forward to collaborating with him, because over the past 5 years, though we have had a lot of drastic change personally and professionally within the Bhavanani family as well as the extended Gitananda yoga family worldwide. It has been interesting how I have ended up into the field of psychology and Anandaraj into the field of sports and exercise sciences. It's really amazing, and I really hope that we both can contribute to Gita, giving another diverse approach, because already I can see through what has been shared that already so many of you who are truly family to me, you all will already be contributing from your fields of expertise, be it allopathy, naturopathy, siddha, yoga therapy, dance therapy, music therapy, and so much more. So I'm really looking forward to bringing in the aspect of psychology, and Anandaraj bringing in the aspect of sports and exercise sciences, and also learning from Gita, most importantly. I really look forward to all the upcoming events, webinars, whatever are being held, because always I think being a forever student is the most important thing wherever we end up in life. So thank you very much to everybody, and I really enjoyed the session by Lothikha and Shamili Akka. Um, it really gave a different perspective. Thank you very much. And yes, Nilachal bhai, we are there for you, with you. And yes, we'll all together, I think as a team, we'll make this possible. So I'm already very happy to see the members of the GITA team who have already come together, and also looking forward to many more others also joining us, because I think as a team, Ammaji would say, together everyone achieves more. So let's keep that in mind and take this forward. Thank you very much. And
Thank you so much, Divya Priya, for those words. And I would like to reiterate that the vision of Gita is where different systems come together to benefit each and every person who's seeking care. So, be it the traditional, be it the modern systems, be it for the body, be it for the mind, we want to make sure people can have the accessibility to all these systems of healing, health, and wellness, and hope that this will be something that can become a model for integrative health worldwide, because we hear this term bandied around a lot, but we don't hear it practiced much. So we would like to make that happen, seeking all of your cooperation, collaboration, and blessings for it. So thank you so much for this wonderful event, and over to you, Nilachal, for the closing down of today's session.
Thank you, sir. And before closing, there is a questionnaire that is being shared by Roshna, who is trying to do a survey on women's health awareness. So she will share here in the chat box, requesting all the women who joined in this session, please fill that form. And it is a survey that we want to know how much you know, and after this session, how you are aware of this all details. And before closing, we are above the time, and it is a very common phenomena. Now I understood, if we have Dr. Sir, then it is not going to be the same time that we have started. So yeah, so thank you for being here, and thank you for joining and having patience with all those glitches that occurred in between. And I would like to thank to all the speakers who took valuable time and shared their knowledge with us. And it is very important at this modern time, as I mentioned in the beginning, and their wisdom, their time, and generosity. And thank you to every participant for being present and engaged. And stay connected for upcoming programs on 17th. Again, I would like to remind you, we have again a hybrid session with Dr. Lothikha, and whatever is being left here, we will be discussing there, and again a panel discussion. And I would like to invite here, we will be seeing Dr. Shamili ma'am also, hopefully there, to answer your questions. And till then, namaste and pranam, and we will close with the Shanti mantra, requesting all to join together. लोका समस्ता सुखिनो भवन्तु, सर्वे जनाः सुखिनो भवन्तु। ओम शांतिः शांतिः शांतिः। Thank you all again. See you on 17th. Namaste and pranam. Thank you, sir.